Hello everyone, and thank you for being here. We're speaking on the territory of the signatories of Treaty 7, and I'd like to acknowledge the Métis people of Alberta who share a very deep connection to this land. Today, I'm joined by Emily, who lives in Cochrane and is a single mom to an adorable 8-year-old boy. And we're also joined by Dr. Annalee Coakley and our amazing Alberta NDP varsity candidate, Dr. Luanne Metz. Yesterday, I began the conversation with Albertans about a better plan for a better future. And I promised that I would start with delivering better health care from day one. Everywhere I go in the province, I hear from Alberta families who tell me they're frustrated with the chaos in our health care. We know families deserve a relationship with a family doctor who knows them and has their histories, who's a phone call away when they are sick or hurt. They deserve world-class access to public health care. Currently, as many as 800,000 Albertans don't have access to a family doctor. So my message to every one of them is that under an NDP government, if you need a doctor, you will get a doctor. Over the past 4 years, our healthcare has been thrown into chaos by the UCP. Now they'll tell you they've fixed it, but Albertans aren't feeling it and they're not buying it. Our ERs are still full, our ambulances are still delayed, and many are waiting months and months for critical tests and surgeries. The fact is, the UCP just can't be trusted on healthcare. From picking fights with doctors and nurses, and sometimes going as far as to showing up on their driveways, to deliberate efforts by Danielle Smith to dismantle public health care and make you pay to see a family doctor. Danielle Smith and the UCP are focused on the wrong priorities. The Alberta NDP is focused on what matters to you, and I'm focused on your family's health and your family's well-being. Our family health team's plan is built around your priorities, as I said. Albertans will have access to world-class health care right in their own communities. You have access to a doctor who works closely with other professionals like nurse practitioners, registered and licensed practical nurses, mental health therapists, pharmacists, social workers, dietitians, community paramedics, community health navigators, physiotherapists, midwives, speech-language therapists, and so much more. It will ensure that all Albertans have access to a family doctor, not 2 weeks or months from when they need one, but in a matter of days. We'll make sure that these transformational changes and our work will begin right away. We will move to support flexible hours for family doctors and health professionals across the province. Extending hours to include evenings and weekends is something that health professionals have actually been asking us for years. And it's better for families and working parents, some of whom struggle with taking time off just to make it to a doctor's appointment. We will also invest $350 million over 4 years to build and to ensure Albertans across this province get their concerns addressed faster. And we'll invest $400 million over that same 4 years to hire family health team members, adding 4,000 allied health professionals to primary care. And I'll be sharing more about our health recruitment and retention strategy in the coming days. And for the record, unlike Danielle Smith's plan, we promise you will never have to take out your credit card in order to access this health care. For the healthcare system itself, this plan means decreased pressure on ERs and ambulances and lower pressure or lower waits for acute care. It means doctors will have time to focus more on your medical care and less on paperwork. It means great places to work and provide comprehensive care for patients. Now, Danielle Smith will try to say that none of this can be done. But here's the thing. She says that because she can't do it. She just doesn't have the political will. She doesn't have the focus. She doesn't have the determination to deliver better health care. But I do. We will deliver better for you, for Emily, for her son, and for all Albertans. So I'm now happy to turn it over to Annalee to share her story of just how the crisis in healthcare has been impacting her family.
Good morning, everyone. My name is Annalee, and I live in Cochrane. Thank you for letting me share my personal experience with the challenges my family and I have faced. Last year, I suffered from a back injury and was referred to my family doctor for an MRI. After waiting for months, I called to follow up and learned that my referral was lost and that it would result in my MRI appointment being pushed to the bottom of the queue. Months later, my mother had to move in with me to help me care for my son because my pain had worsened to the point of becoming bedbound. At this point, I was beginning to develop new symptoms and was told to go to the emergency department. I was admitted to the hospital and operated on after 2 days of waiting on standby. This was now considered an emergency surgery. If I hadn't fallen through the cracks in the first place, my care wasn't delayed, and for months on end, I might have never needed the 2 surgeries to begin with. And I might need another one soon. Right now, referral wait times are over a year. I don't have the option to pay out of pocket and visit a private service provider to get the care I need when I need it. And even if I wanted to put a price on my family's health, it simply isn't an option for me. It shouldn't have to be an option for any Albertan. Unfortunately, I'm not the only one who has experienced difficulty with the health system in my family. My 8-year-old son is neurodivergent and requires multiple specialized supports. He and I don't see the same family doctor because his was the only one accepting new patients in the town we lived in when he was born. This means that I have to drive an hour from my home to see a family doctor because we can't find him a local doctor. His pediatrician is in Carstairs, his specialists are located here in Calgary, my family doctor is in Didsbury, and we live in Cochrane. Recently, my son had an ear infection. I called for an appointment and was told they thought my son was under the care of a pediatrician in Calgary now and that I should go there. When I called that office, they told me he wouldn't be able to access treatment for something outside of his specific referral. So we ended up going to urgent care, and neither of his own physicians saw him. It wasn't reasonable or fair to ask a child, one with sensory challenges, in severe pain, to wait several days before he could see his doctor and begin to feel better. And it wasn't reasonable or fair to ask me, as a helpless mom, to watch him suffer for that long. As a single parent juggling shift work, my own specialist appointments, and my son's appointments, I've struggled greatly to find affordable childcare that has the hours of operation I require, as well as the expertise to adequately support my special needs son. The drive to and from our respective appointments is almost always over an hour because there just aren't resources locally. Inaccessibility to treatment should never be why someone's condition becomes a crisis or a chronic problem with permanent detrimental effects. Thank you for letting me share my story with you today.
Thank you, Annalee. And I just want to say that you know, the fact that an ear infection became such a problem is exactly the kind of thing that we know we can fix through the use of family health teams. We are here to deliver better health care for you and countless other Albertans who have these kinds of stories of frustrations. Now, I'd like to welcome Dr. Coakley, a family doctor who practices here in Calgary, to share a few words.
Good morning, everyone. My name is Dr. Annalee Coakley, and I'm a family physician who provides care to vulnerable newcomers to Calgary. I also teach immigrant and refugee health to medical students and residents at the university. further ahead. Thank you. Today, I'm here to speak in support of the Alberta NDP's proposal to support family health teams. As healthcare providers, we have a responsibility to ensure that our patients receive the best possible care. However, this can be challenging in the current healthcare system, where administrative burdens and overwork have led many physicians exhausted and overworked. Family health teams offer a meaningful solution to these challenges. By providing team-based care, we can tailor resources to meet the unique needs of the community we serve. For example, in my practice, I work with interpreters who are able to communicate with our patients in their first language, thereby more effectively understanding their needs. A family health team could also include physical and occupational therapists, social workers, housing advocates, mental health professionals, amongst others. The possibilities are endless, and the approach is holistic. Team-based care is also flexible, responsive, and addresses the unique needs of each community they serve. Patients can access different services and programs that collaborate with each other without having to wait for referral after referral, visiting clinic after clinic just to solve one problem. This model also ensures that patients receive the highest quality of care possible by enabling providers to work with one another to meet their needs. But the benefits of the team-based care extend beyond to just patients. Physicians and other healthcare providers can serve a large number of patients and provide better quality care without sacrificing their own well-being. Newer doctors and residents are carefully weighing the option of choosing Alberta as a place to practice, and it's important that we take steps to make sure that Alberta is the most attractive option in Canada. We have a responsibility to care for our patients, but we also have responsibility to care for ourselves and our colleagues. We need help and we need change. By prioritizing the best outcomes for patients' health, we can make healthcare systems more fulfilling and sustainable for healthcare providers. This model of care is essential to providing the highest quality of care possible, while also supporting the well-being of healthcare providers. Thank you.
Well, thank you very much, Dr. Coakley, for sharing your experience with us here today. You know, Albertans are so grateful for your service and for your advocacy. Annalee and Dr. Coakley have shared their difficult, how hard it has been for families to get their access to health care, and just generally how hard the crisis has been under Danielle Smith and the UCP. This is just unacceptable, and the fact is we need to do better. I will. The government I lead will make sure we get this done. Thank you, and any one of the three of us are happy to take your questions you have.
Okay, everyone, we're going to begin here on location with anyone who has a question. If you are on the Zoom, please push *9 or use the raise hand function. We will begin, if anyone wants to line up behind me. We'll go with one question, one follow-up. Joel, go ahead. Just introduce yourself, please.
Hi, Joel, CBC.
Hi.
In Ontario and BC, in recent months, governments have introduced more privatization to deal with backlogs. Is that anything under any scenario the an NDP government would consider?
I'm sorry, the last part of it that you said was?
Is it anything under any scenario that an NDP government would consider?
Very brief windows, it might be possible to find a setting where that would work. But generally, we also know, the research shows, and more importantly, experience shows, that the most cost-effective means of delivering public health care, as well as the means that gives the best care for patients is actually through public delivery. Here in Calgary, we've seen the result of the UCP's latest experimentation with privatization when it comes to lab services. Basic blood tests, basic results for tests that determine all the rest of your care should be taking days. Instead, they're taking weeks and months. And so we need to always be focused on what's the most cost-effective and effective way to deliver the service for the best outcome for patients. And that will be the question we always ask.
Some primary care clinics in Alberta have started to charge membership fees in order to provide certain guarantees, priority appointments, that sort of thing. Is there anything specifically that an NDP government would roll back in terms of options like that?
No, we are going to work very hard to try to limit the opportunity for that, and certainly the proposal that we have with respect to family health teams are the exact opposite of that. Nobody should have to pay a premium to get access to comprehensive coordinated care. That should be a given, because that makes the success of the healthcare services that people receive greater, and it takes pressure off the whole system. So commodifying that, making people have to pay for that, is the exact opposite of what we want to do. We don't want people's health care and the quality of their health care to depend on whether they can afford any one of a number of extra fees that Danielle Smith and the UCP are intent on imposing on Albertans.
Hi there, Aaron with LiveWire Calgary. Obviously, this plan relies on the attraction of family doctors to Calgary and elsewhere in the province in great numbers here. The reality is we're competing with other jurisdictions for these same individuals here. So how do we get these folks here, and what is that plan on that?
Well, let me say two things. First of all, in terms of the immediate success of the plan and the first stages of the plan, it is actually focused more on expanding the capacity of current doctors to see more patients by giving them more supports around the practice that they deliver, so they actually have the ability to see more patients. So that's one of the things that is fundamental to the model. Going forward, and what we've heard from many doctors, including doctors like Dr. Coakley here, is that you'll actually succeed in recruiting more doctors and bringing more doctors back into practice if they are given the opportunity to practice in these kinds of team settings where they are more supported and they're able to focus on what it is they went to school for, which was to care for patients rather than doing all this other running of businesses. So between that, and then of course we will also increase education and ensure that we have a stronger relationship with doctors, because we know that's critically important too. Here in Alberta, we are seeing doctors choose other jurisdictions because they don't trust the leadership of Danielle Smith and the UCP. And I think that we can get back to being a popular destination for doctors all across the country.
Would this plan require the restructuring of AHS and return to the board system at all?
No, it doesn't require any kind of requires thoughtful planning and adequate resources.
Hey, Jason Markusoff with CBC News. I had trouble hearing you 5 feet away from you here because there's no mic or speaker or anything, but it sounds like what you have spent this morning announcing is the family health team plan that you announced back in February. I didn't hear anything particularly new. Maybe I missed something, but this is day 2 and you're already re-announcing things. What gives?
Well, I think what we did do is we fleshed out the details a bit. One of the new elements of it is that we are talking about, as part of the family health teams, we're going to expand the hours of the clinics. We're going to ensure that the funding allows for both healthcare providers and patients to have broader access over longer hours. So that's the key, and we've also sort of talked about how the funding will roll out a little bit further out than the 2 years we'd originally talked about. So those are pieces of what we're talking about today. But no question, Jason, we are also here to remind folks about what our plan is. You and I both know folks listen to policy proposals at greater and lesser degrees over the course of any given year. And this is a fundamentally important proposition that we are making to Albertans, that we want to help their healthcare, we want to make it better. And so sometimes you have to say that more than once.
Further to my colleague Joel's question, do you intend to roll back any of the current private sector role that exists within the Alberta health system?
Well, I think the key, certainly the most recent contracts that were signed are very troubling to us. We haven't been able to see the full contracts, but we are very worried about the impact that the most recent round of surgical contracts will have on availability of anesthesiologists when it comes to what should be prioritization of people's surgeries, so that we see anesthesiologists go into these clinics for relatively simple surgeries while people who are in dire need of the surgeries wait because the contract says the anesthesiologists, their bigger priority is the private surgery. And so we're going to look at that. But overall, Jason, what we are going to do is we're going to look at the most cost-effective and the most successful means of delivering the best service to Albertans. That is the lens through which we will examine all of these things.
We're going to take some questions from the phone now. We're going to begin with Kieran Levitt of the Star. And for everyone on the phone, please just a reminder to unmute yourselves. Kieran, go ahead.
Rachel, obviously we're expecting the Arthur Pawlowski ruling today. I'm wondering, what effect do you think that ruling will have on the campaign, or what effect do you think it should have, if any at all?
Well, listen, Mr. Pawlowski is someone who was charged as a result of behavior supporting a blockade that cost our economy hundreds of millions of dollars, and also encouraged protesters to engage in violence against the police. And Mr. Pawlowski is someone who Danielle Smith has lots of time for, who she aligns herself with on many fronts. And I think that this will further underline the real level of nervousness that many Albertans experience, because they know that Mr. Pawlowski's values are very much on the extreme end of things. They don't align with the values of the majority of Albertans, and the fact that the current premier has so much time for someone like that makes people very nervous about whether they can count on Danielle Smith's leadership.
Kieran, do you have a follow-up?
I do, thanks. Do you think that today it would be, given the sensitive nature of it and the fact that there's an ongoing, we presume ongoing ethics investigation, do you think it would be appropriate for Danielle Smith to offer up her comments on any ruling that comes down today?
Listen, I think that Danielle Smith has to make herself available to speak about her conduct with respect to the Pawlowski case. Separate and apart from what the courts decide and whether there are appeals and all those things, Danielle Smith is on video very clearly announcing that she plans to interfere with the administration of justice on behalf of somebody whose actions cost our economy hundreds of millions of dollars, and who was encouraging people to think about engaging in violence against the police. And so she has an obligation to answer to Albertans for that. I don't care if it's today, if it was a month ago when she claimed she was going to sue people, or 2 weeks from now. Quite frankly, Albertans are very nervous about the extreme nature of Mr. Pawlowski's views, and the fact that Danielle Smith clearly aligns herself with him. And so, and up to and including being prepared to interfere with the administration of justice on his behalf. So she needs to answer for that, and she can do that at any time. She's hiding because her record is on this is deeply disturbing to the vast majority of Albertans.
We have time for question from one more person. We're going to go now to Josh Aldrich. Just unmute yourself, Josh.
Thanks for taking my question. When we look at this team approach that you're talking about today, is this based off of other models out there? And if it is, what kind of success rate has that had in dealing with a shortage of family doctors?
So we've done a lot of research on this. We've seen it work in other international jurisdictions, and we've been able to, and we've actually used very conservative numbers for the degree to which it expands the ability of family doctors to treat more patients. When we do our estimates about how it will in fact treat at first hundreds of thousands of more Albertans and ultimately 1 million more Albertans. Ontario has started work on a version of this, and they're just ramping it up more. But we've also, as I've said, seen it in other jurisdictions, and we can get you the specific ones after this press conference.
Josh, do you have a follow-up?
I do. So a lot has happened, obviously, since the UCP came into power here in 2019. But this has been an issue that's been going on for as long as I can remember, in doctor shortage. How much of this is impacted currently by the impacts of the pandemic, but also we look at the last year and we've had record migration to Alberta and specifically to Calgary. How much has that kind of changed that discussion about the type of shortage that we're seeing here in Calgary and in Alberta?
Well, I think there is an issue all across the country, but the intensity of it has increased dramatically in Alberta, primarily because the UCP, once they got elected, they immediately broke their promise to respect public health care, and they ripped up the contract with doctors. And then they spent 2.5 years fighting with them, including in some cases on their driveway with respect to, and I'm referring there to the then health minister. And so they fought with doctors for 2.5 years in the middle of a pandemic. And so those actions took what was a problem but not a crisis, and they fanned the flames and turned it into a crisis at the expense of people like Emily and her son.
Thank you so much. That's all the time we have today.
Thank you.